Dr. Steinman has been working with a severely disturbed population, throwaway patients, patients that other clinicians have declared hopeless over the past 30 years. And I'm sure you're about to find out that he's learned a few things in those 30 years. So we also just shared briefly that our hobbies and things we do outside of our work keep us going, and one of his is tennis. So anyway, without further ado, Dr. Steinman.
These are some excerpts from my upcoming Karnac book, Treating the Untreatable. The intensive dynamic therapy of psychosis has become a nearly lost and forgotten art in this era of revolving hospitalizations, excessive antipsychotic medications, and wandering homeless schizophrenics. Yet it remains a powerful tool for healing and for change. As a practicing psychiatrist in San Francisco for nearly 40 years, I've been very involved in the office care and treatment of a number of people who were so mired in solipsistic beliefs that they were diagnosed as either schizophrenic or suffering from pervasive paranoid delusions. Such patients were considered untreatable and hopeless by other mental health professionals, and often referred to me since I regarded them as potentially treatable. I never viewed them as impossible, and for various reasons of temperament and personality, have always thought that even those most disturbed could benefit from understanding what was really going on in his or her internal psychological life. From my earliest days in psychiatric training, I sensed that a true psychodynamic understanding could lead to internal change and gradually external behavioral change, allowing previously delusional and chaotic people to return to the world of function. Over the years, my belief in the possibility of healing, perhaps curing the most schizophrenic and delusional of patients through this kind of in-depth psychotherapy, has been tried with varying levels of improvement and at times success. Success defined as the patient giving up delusions that had lasted for many years and returning to a life of function and relationships. At times, antipsychotic medication has been titrated down and stopped, even in patients who'd been regarded as hopeless for years, if not decades, by a number of other practitioners. A little background. By most accounts, there are nearly 2.5 million people in the United States who are schizophrenic or delusional. They have their own belief systems. For them, consensually validated reality does not apply. They are in a world of their own, certain of the correctness of their perceptions, and unresponsive to the supportive ministrations of friends and families. We've all seen them muttering to themselves, and even worse, responding. They seem beyond the ken of human discourse. There is no there. Such people appear doomed to a life of deterioration and severe alienation. Unless their families support them or they are provided a sheltered environment, they are relegated to the status of untouchables. They don't seem to understand how the world works and are trapped in a level of purgatory created by their own misconceptions. For all intents and purposes, they are tortured and lost souls. From my earliest psychiatric training, I questioned the notion that these delusional people were beyond help. During medical school, while working with Ronnie Lang in England in the mid-60s, I arranged to live on a psychiatry ward as just another person, talking with schizophrenic and delusional patients, trying to make sense of how they got into such a predicament. Though Ronnie and I parted ways as to the worth of psychosis in such a mad world, we both believed that there was a meaning to the delusional person of his madness, if only he or she could begin to comprehend his own symbols and metaphor. From my own personal experiences living and talking and working with schizophrenics, reading and studying everything I could, I began to doubt that such people had to remain lost forever. Attending weekly case conferences at Chestnut Lodge while working for the National Academy of Sciences Drug Evaluation Study furthered my sense that medications alone provided only partial help. It seemed clear that a dynamic psychotherapy exploring the person's life was essential as well. By the time I started my Mount Zion psychiatric residency, I thought it was quite likely that even the most disturbed and chaotic schizophrenic or delusional patients could be understood and helped. My orientation is psychodynamic, even with severely disturbed patients across the psychotic spectrum. Such an approach is based upon the belief that there are psychological and emotional factors that are unconscious to the patient. The importance of talking about and dealing with transference and countertransference from the past to the present, and the existence of certain psychological resistances to dealing with issues and making psychological changes. Over the last 40 years of psychiatric practice, I found that a number of these allegedly unresponsive and untreatable, severely disturbed patients, diagnosed as suffering from schizophrenia, paranoid delusional disorder, and multiple personality disorder, have responded to an in-depth, exploratory, dynamic psychotherapy. In a number of cases, antipsychotic meds have been titrated down and stopped, as patients who'd been floridly psychotic for decades began to understand the psychological factors leading to their deterioration. Because this type of in-depth work with psychotic people is so rarely done, so frequently questioned, and so rarely written about, I've written Treating the Untreatable, a chronicle of 13 schizophrenic or delusional patients who responded to such a dynamic approach. Some of these patients were hospitalized and medicated for years. Others were in and out of hospitals repeatedly before an attempt was made to help them understand the meaning of hallucinations, delusions, and previously incomprehensible psychological states. My goal in writing this book is to demonstrate through these successful clinical case examples that an intensive psychotherapy may aid even the most distressed through the morass of psychosis. Treating the Untreatable articulates a rationale for the use of an intensive dynamic psychotherapy in such a disturbed patient population and proves false the current belief that such an in-depth exploratory psychotherapy is of no benefit in such severely disorganized patients. Supportive therapists believe that the therapeutic relationship will gradually lead to the development of positive superego introjects which will diminish and replace the archaic, denigrating critical introjects that often occur in schizophrenia. Relationship is the theme of this conference. In practice, however, as the following clinical presentation and a number of other cases in Treating the Untreatable demonstrate, the therapist-patient relationship and trust in the therapist are not enough in and of themselves to relieve and heal a person fractured by a delusional system. A previous supportive psychotherapy is likely to leave untouched an essentially psychotic stance of delusion and projection onto external reality of inner thought processes. Although heroic efforts were made in previous supportive psychotherapies, clinical improvement occurred only when a more interpretive, analytically oriented approach was attempted. To demonstrate the usefulness of an insight-oriented approach in a person with psychosis, let's peek into the world of one of a number of my patients who gave up their delusional beliefs in the course of such an inquiring psychotherapeutic process. When I first saw Daphne nearly 25 years ago, she was a brown-haired, stylish woman in her mid-50s with blazing dark eyes. She was in the hospital, perhaps the 35th time she was hospitalized in her life. She was alternately withdrawn or acquiescent during that first meeting, with occasional flashes of the belligerence that had led to her being thrown out of several hospitals for her pugilistic skills, as she would physically attack other patients or the hospital staff. Her very well-trained psychiatrist of 20 years was retiring. He introduced us. She was an attractive married woman, a mother of two, who had made a number of suicide attempts over the previous 30 years. At one point she had jumped from the Golden Gate Bridge, but had seemingly miraculously fallen on the catwalk below, broken many bones, and spent a number of months in the hospital recovering physically.